I'm Sabrina Register with the inaugural newscast of Global Health News Network, a network that delivers trusted medical knowledge to whomever needs it, when they need it, on all available platforms. Today's newscast will cover some of the latest medical news, an in-depth interview with Dr. Richard Weiss, long associated with the Parkinson's Trust in the UK, a panel discussion with prominent epidemiologists throughout the globe, and a conversation with this network's founders. But first, the news. The World Health Organization announced on June 25th the end of the 10th outbreak of Ebola virus disease in the Democratic Republic of the Congo, or DRC. The outbreak, declared in North Kivu on August 1st, 2018, was the second largest in the world and was particularly challenging as it occurred in an active conflict zone. The disease killed 2,287 people and sickened another roughly 1,200 people. While this 10th outbreak in DRC has ended, the fight against Ebola continues. On June 1st of this year, 7 cases of Ebola were reported in Bandaka City and neighboring Bakoro Health Zone in Equator Province. That forced officials to declare an 11th outbreak. WHO's Digital Health Technical Advisory Group, which ensures digital health initiatives are well-defined and aligned, recently completed a 2-day planning event. The retreat, held last month, coincides with the Infodemic Conference. An infodemic is an overabundance of information, some accurate and some not, occurring during an epidemic. Digital information distribution is a key dimension of the infodemic. The advisory group's work is under the umbrella of the Global Strategy on Digital Health 2020 to 2024. Its purpose is to promote healthy lives and well-being for everyone, everywhere, at all ages. To deliver its potential, national or regional digital health initiatives must be guided by a robust strategy that integrates financial, organizational, human, and technological resources. An effort to better train and equip Indian doctors to use ventilators during the current COVID-19 crisis just became reality thanks to a unique partnership spanning the globe. MedVarsity, Asia's largest edtech company with more than 45,000 trained and certified medical professionals, has partnered with Boston Children's Hospital and their ventilator simulator. Boston Children's Hospital, or BCH, through its Open Pediatrics program, has developed one of the best and acclaimed online ventilator simulators. The ventilator simulator is an immersive online mechanical ventilation training tool. It incorporates the most recent evidence-based guidelines in pediatric and adult ventilation, as well as COVID-19 information and COVID-19 patient cases. The virtual ventilator incorporates real-time changes in vital signs, ventilatory parameters, patient appearance, arterial blood gases, chest x-rays, and much more. More than 18,000 doctors and other healthcare professionals have been trained thanks to the ventilator simulator. The Washington Global Health Alliance, based in Seattle, Washington, announced PATH and other partners celebrated the 15-year anniversary of one of the most effective investments in global health, the U.S. President's Malaria Initiative. It has contributed to saving more than 7 million lives and prevented more than 1 billion cases, and today protects more than 570 million people at risk of malaria. On a lighter note, the Puyallup Tribal Health Authority, located in Tacoma, Washington, has launched a summer virtual Wellness Wednesday. An adjunct to their full-service health clinics, this program focuses on local specialties. These include berries, fish, and drinks made from local berries. India Today, a widely read daily news magazine, has developed a global fact-check network. This includes issues of health reporting. Fact-checking has become an issue globally. Recently, they attempted to verify the reality of COVID parties throughout the world and discovered a mixed picture. Some picture postings of COVID parties, for example, were found to be false, but others probably true. We're following this news with great interest. The journal The Lancet reports that the University of Oxford, in collaboration with other renowned universities, is harnessing data by NHS Digital, the UK's national information and technology partner to its healthcare system, for its study looking at weekly cardiac-related hospital admissions during the COVID-19 pandemic. Researchers documented a reduction in admissions of patients with heart attacks in England during the pandemic by comparing weekly rates in 2020 with those observed in 2019. Researchers noted that admission with the most serious type of heart attack caused by a complete blockage of an artery supplying part of the heart fell by about a quarter, while rates of admission for heart attacks caused by a partial blockage of blood supply to the heart fell by 42%. Admission rates partially recovered in April and May, but remained lower than last year. GHNN will report on follow-up from this study. And that's the latest news from Global Health News Network.